Right. Good afternoon, everyone. Thank you very much for joining our Rise and Learn community of practice. In these sessions, we invite not just HR practitioners, but we also invite business leaders to engage in real-time conversations on what's happening in the business and the world. So welcome. Once again, in this session, we are privileged to have a team from Cigna. I will be introducing them shortly, but before I do that, I want to introduce myself. I'm Emily Kamundi Osoro. I lead the business at Rise and Learn. We are a HR consulting firm dealing with human resources outsourcing services, training, coaching, and consulting. You're very welcome to this session. We will be discussing COVID-19 impact to mental health, and you'll be listening to key findings from Cigna's COVID-19 Global Impact Study. Allow me to begin by introducing Maxime Claessens. Maxime has been servicing intergovernmental and governmental organizations when he started his career at Cigna 10 years ago. In his role, Maxime assisted IGOs with strong representations in US, Europe, Africa, and Middle East, with the design, implementation, and aftercare of medical and life protection insurance solutions adapted to the needs of local staff members and the specifics of countries where they are located. In his current role as head of Client Management Africa, Maxime leads a team of client managers collaborating with corporates and brokers across Africa. Maxime is also heading our the HQ for Africa in Nairobi, leading 150 employees. Maxime will be saying hello in the next bit, and he'll tell you a little bit more about himself. Let me now introduce the ladies, starting with Payal Shah, who is the head of business development in East Africa. She possesses excellent business acumen and brings to Cigna 14 years of experience across business development, global financial markets, relationship management, sales and leadership, having worked in global banks, corporates, large investment, and insurance firms. In her current role, Payal focuses on building opportunities for Cigna across East Africa, achieving profitability and customer goals, and providing support for internal and external stakeholders. She also drives broker and client relationships in that market. And then we have Helen Kiburi, who is the Senior Regional Representative for Kenya in the region. She is currently based in Kenya, which is responsible for relations for our Africa clients. Her main role is to ensure that Cigna colleagues understand the local context in various countries, and as much as possible that the connection between members and Cigna is maintained positively. She joined Cigna in 2007 as a nurse case manager and moved to the Nairobi office in 2015. She has held the role of office and team manager for 3 years. And in 2018, February, she moved to her current role. Her background is in nursing, healthcare management, health insurance, and she's very passionate about helping people, troubleshooting, providing health information, and member education. So ladies and gentlemen, help me to welcome the Cigna team, and I will now hand over to is Maxime or Payal? Welcome.
Yeah. Thank you, Emily. Good day, everyone. I hope this session finds everyone and their families safe and in good health. My name is Payal, as Emily already introduced. I head the business development unit for Cigna across East Africa. As with us on the call today is Maxime, who's the country director Cigna Kenya and also heads client management unit for Africa, as well as Helen Gatwiri Kiburi, who's the senior regional rep for IGO and NGO team. So today we're going to focus on how businesses have received an increased risk due to the impact of COVID-19, the toll it has taken on employee mental health, and what are some of the positive steps that corporates and leaders are or can take to safeguard the most critical asset of their business, which is the employee, by enhancing culture and in turn workforce productivity and success. In times like this, empathetic and effective leaderships play a key role in the well-being and success of employees and the organization itself. So our Cigna COVID-19 Global Impact Study offers a deep perspective into this. We've continued to conduct this study in 5 phases to stay informed of people's well-being and needs during this exceptional time. Today, we will discuss some of the highlights from our survey and the importance of creating a culture that prioritizes mental health, stress management, and overall well-being of the employees, so as to create and maintain a healthy and productive work environment, thereby reversing the impact the pandemic has had on the continent's economy. As we know, economies around the world are slowly finding ways to return to normal, but offices and work cultures have sort of transformed irrevocably, and new concerns have cropped up. In such a scenario, the importance of well-being, physical and mental health for every employee has become the cornerstone of business survival and success. But first, let me share a brief introduction about us and our regional presence. Okay.
I think Helen should be sharing the screen.
Yes, Helen, please share the screen.
I'm sharing. I'm on the second slide. You don't see it?
We don't see anything.
Oh.
Okay.
Click on the share button below. Yeah, there we go.
Yeah. Could you just maximize it? Maximize it. Yeah.
We are okay? Yeah.
Yeah.
Good. Thanks.
Go ahead.
So here's an introduction about who we are. For more than 200 years, Cigna has led its mission to help people live healthier, more secure lives, and is recognized as one of the leading providers of health services and solutions to individuals, employers, and governments. In fact, Cigna is the insurer of choice of many international companies and international organizations as they expand their operations into the African continent. I'm also happy to share with you that in the period 2020-2021, Cigna moved up 52 spots on the Fortune 500 list to become number 13 on this list. In Africa, we have been servicing clients for over 60 years, starting with the large global IGOs in our portfolio. This has evolved over the years, and we are proud to say that we also have a plenty of NGOs, corporates, and individuals being supported by Cigna on the ground here today. Our local presence in Africa entails our Nairobi office, where we now have 150 staff members employed, local case managers in DRC, South Africa, and Kenya. We have a fully fledged sales and administrative office in South Africa, in addition to localized and dedicated teams servicing members. With almost 2,000 healthcare providers across Africa in our network, we are able to facilitate easy access to affordable, quality healthcare in each of the African countries, both in cities as well as in remote areas. As of now, Cigna has been servicing over 250,000 members, both locals and expats across Africa, making us the international provider of choice with by far the largest footprint. Next, please. Thank you. So where does the world stand now? Let us deep dive into the key topic for today, which is COVID-19 and the impact it has had on employees across the world. The COVID-19 pandemic has swept our world into a new reality of remote working, making us connect in ways like never before. We've had to unlearn and learn a new way of living, interacting, navigating new issues in these extraordinary times. Understandably, people are likely to experience heightened levels of anxiety and stress about different aspects of their lives. And as we know, stress can cause a wide range of physical illnesses and can also lead to burnout among our employees. It impacts their ability to participate meaningfully in both their personal and professional lives. At work, it can lead to absenteeism and lower engagement and productivity levels. For working parents, they're continuously balancing working from home as well as homeschooling, and in many cases with little or no help. For many, the reduced human interaction has added on the layers of issues to deal with on a day-to-day basis. Many of us are struggling with an underlying fear of becoming redundant, which may lead to an increased pressure to always be accessible and switched on. The rise in chronic stress is detrimental to health of human bodies, which can lead to burnout, ability to have a meaningful personal and professional life, leading to absenteeism and lowered engagement and productivity levels. For SMEs in particular, the risk of closing shop poses a higher threat. Thus, it is important for business owners to pay close attention to the health of their employees. In such times, employees look up to their leaders for guidance and assurance. And as companies, we need to show more strongly to our employees and establish regular check-ins to know how they are feeling. Our view as Cigna is that there is nothing more critical in this process than to listen to your employees, understand how they feel, and offer them the resources to keep them motivated and give them a chance to enjoy a fulfilling career and life. At this juncture, I'll now open the floor to Helen to talk us through how we can support our employees and how we as employers need to have a finer understanding of the stance of our employees. Welcome, Helen.
Thank you, Payal. Yeah, so how do we put our finger on the pulse? Every year, we conduct an annual survey to measure people's perceptions on health and well-being. This year, with the pandemic impacting every aspect of our living, we planned our survey to study mindsets and behaviors before and after the stay-at-home phase of the pandemic. We launched our first Cigna Covid-19 Global Impact Study, a new series of studies from Cigna and part of the annual Cigna 360 Wellbeing Survey. The study aims to understand the impact of COVID-19 on people's health and well-being across 5 key indices of physical, social, family, financial, and work. The study was conducted in 5 phases, starting from January 2020, when the pandemic began, at a pre-pandemic time, leading to different phases across April, June, August, October, and December 2020. The results will help you identify the core elements and gaps that impact employees' peace of mind and wellness. And this year, we focused on a few topics, including loneliness and stress management. The results were very insightful, to say the least. Now, let's take a look at some of the key findings across the markets this year. Global Health Index performed well with 60.9 points. So let's explore the main themes behind this scores. Now, as we continue to live through the ups and downs of the lockdowns and restrictions in response to the pandemic, people are craving normalcy. We have witnessed a drop in people's perception across all 5 indices, from pre-pandemic levels to January 2021. The most noticeable drop, obviously, has been the financial well-being. However, a different picture emerged in markets where the vaccine deployment had commenced or approval was imminent. So now you can see, as the economic impact of lockdowns and restrictions continue to be felt globally, worry about financial security continues to be the key driver of stress in all the markets the survey was conducted, with 49% of global respondents saying they are stressed about their current financial situation. Globally, the change in stress levels in this latest study can be attributed to people are finding it difficult to maintain their current standard of living, with less than a quarter, and that is 22%, saying that they feel confident doing so. Only 28% said they had financial ability to pay for their mortgage or housing, with almost 3/4 uncertain that they will be able to do so. And only 19% of the global respondents said that they had the financial ability to meet their own and their family needs when planning for medical finances. As little as 1/5, and that is only 20% of respondents, said they were financially secure in case of emergencies, such as not being able to work or even when they lose their jobs. So we observe that these changes correspond with a considerable uncertainty during the period that the survey took place in late November and December 2020 last year, including the lack of clarity around the COVID-19 relief packages, uncertainty around vaccine delivery, and news of high unemployment rates. In previous reports, we have seen that remote work in response to the pandemic has largely successful for employers and employees alike. But looking at well-being indices since the beginning of the pandemic, people who worked from home reported higher scores across different aspects than people who had to work in an office environment, with the exception of financial well-being, which remained consistently throughout the crisis, whether people are working from home or in the office. More than half, that is 53% of global respondents, are either working from the office or spending at least 80% of their time in the office. Interestingly, an overwhelming 72% employees prefer a new hybrid style of working, with 2020 reflecting that organizations are able to facilitate remote working for several different non-job site dependent roles. A hybrid work environment is likely the outcome of the pandemic. This has been reflected in policies implemented by several organizations across the world that have transformed their offices into collaborative spaces, including us here at Cigna. So since the beginning of 2020, different models of care have become embedded in our new normal. Notably, virtual health is now a widely requested as part of the mainstream for the healthcare. 77% of people say they would choose to have a diagnosis virtually. However, when we asked how likely they would be to use virtual care if they could connect with their regular doctor, it increased to a remarkable 88%. So 88% of the respondents don't mind to have a virtual consultation with their doctor using telehealth services. The trend towards increased usage of health and well-being apps seems to continue, with 79% of people now reporting that they would consider or prefer virtual rather than face-to-face engagements when it comes to general advice, such as nutrition and lifestyle. And even for us here in Kenya, I think we have seen that in the last months of the pandemic, a lot of the local facilities have moved to telehealth. It is now possible to order drugs online and receive them at your doorstep, and it is possible to have a consultation with a doctor via phone. We also see strong interest in virtual health for mental health support, such as therapy and counseling. 61% of people say that they would consider or prefer to have virtual consultations, opening up the potential to rapidly expand mental health provision. So now, as we enter a new world, we will observe changes in habits and behaviors of consumers around us. Unsurprisingly, the survey revealed that people will continue to pay more attention to their mental and physical health. And I think now we hear this around our friends and our relatives, that people are starting to pay more attention to their health in terms of physical exercise and even annual checkups. In fact, majority of the participants, and that is 53%, will be more alert about the coverage of their healthcare plans. This pandemic has understandably increased concerns around physical well-being and health. And we also see that with organizations, with the management and the HR team, going back around the table to reassess the kind of health plan that they have based on the outcome that they saw for their workforce during this pandemic. But the key highlight that I want to leave you with is this: 34% see changes in how they will manage their work. A core behavioral shift created by the pandemic is how employees have become aware of their mental health needs and how they will manage their health going forward. 40% believe that they manage their health differently. So this is the reason we start to see people really changing their habits around their physical and their mental well-being. So now I'll pass it over to Maxime to tell us, after hearing these insights, then what can we do? And as Cigna, what are we doing to support our employees? Maxime, over to you.
Thanks a lot, Helen, and good afternoon, everybody. Before starting, just want to apologize. I have a serious cold, so my voice might sound a bit funny, but let's hope it will last until the end of the presentation. So again, thanks a lot, Helen, for those useful insights. And now that we have these insights of the gaps in employee health and well-being and how it plays a key role in employee engagement and business success, the question arises: what can we as employers do to help our workforce navigate the current situation? And I think that's really a very important question. So Helen, next slide, please. So we need to adjust our approach to build culture that promotes trust, empowers employees, and looks at well-being in a holistic manner. To do that, we need to shift our paradigms and understand the importance of well-being as an enabler. As leaders, firstly, we must ask ourselves, do workplace wellness programs really make any difference? And the simple answer is yes. There is an abundance of evidence out there that shows that a workforce that can access and utilize well-being resources will be more productive and invested in the company's success. From reducing absenteeism due to sick leave, to ensuring happier employees and reducing presenteeism, as they call it, well-being can have a transformative effect on the workplace. Employers also need to understand that well-being programs should be personalized to cater to the needs of the employees, as the one-size-fits-all approach to well-being does not work. We at Cigna have a robust suite of emotional well-being offerings that can support you and your team manage their emotional well-being. And you can see them on the slide. So our employee assistance program, to start with, is quite complete. It does not just include a typical counseling. There's also a bit of online cognitive behavioral therapy component, mindfulness program, and work-life balance service. Also some seminars that can be done remotely by employees. For individuals who need minor support, we also have online programs to help them improve their resilience and reduce their stress level. The one small change tool, for example, is a very good one, which will help them to make a small change at a time, which in the end turns into a behavioral change that help members deal with stress. We also offer telehealth to all our clients and customers. And this is, of course, particularly helpful because many people are stressed about the ability today to access healthcare. Telehealth can also be the port of a first call for those who think they might be suffering from, for example, anxiety or depression and need to speak to a GP to determine whether any next steps should be taken. And finally, we also have quite some content that does address things like emotional well-being. We have a health and well-being library with many articles focusing on mental wellness, which just helps to increase the knowledge amongst our members and our clients. And these are actually the solutions that we have to help you help your employees. And they're all available in remote settings to, of course, make them effective during this difficult and challenging current situation. Next slide, please. Thank you. Most companies often overlook simple efforts and initiatives that can go a long way in ensuring employee well-being. Support and reassurance from the leaders are really what employees look out for in a crisis. The leadership that companies show now can seal the trust and commitment of their employees for a long time. And there are three key things that will aid companies in creating that positive and empowering culture. And these include, first of all, providing strong support. Secondly, invest in trainings. And three, keep up with having less. One of the most cost-effective tools in employee management is communication. It's key not only to override the fear that arises from misinformation, but also to encourage employee support and understanding through clearly sharing the impact to business and them. It shows them that we're thinking about them and also, and especially, about their well-being. Our COVID-19 global impact study has shown that 64% agreed that working from home and using technologies to communicate has streamlined connections with their colleagues. HR departments have put in place priority teams that are tasked with ensuring a smooth workflow during crisis while managing employees fairly and effectively. That team identifies sustainable practices that keep the company and its employees in sync during trying times, as well as in the long run. And this can include check-ins and monitoring of employee health and well-being, but also regular mails offering healthy work from home tips, highlighting supporting policies, supporting practices, and all of these will really go a long way in combating that always on culture, while convincing employees that the company really cares for their well-being. So at Cigna, for example, we launched several initiatives, like a social jam, which was titled "Together All the Way, No Matter Where." So really encouraging people to share anecdotes on how they work from home, share things like healthy recipes, etc., etc. By enabling virtual healthcare access for employees, companies can also ensure that people have access to healthcare more easily. And 77% of the respondents said they are likely to get virtual consultations. Sorry, I had to take a sip. Now, there's other things like webinars that we organized. The Connect for Health series has been very well attended, giving a lot of information on different topics, health topics. And in the next few years, we also want to invest in more remote healthcare, as we feel that will really become the norm amongst people. Now, finally, invest in training is really important, and the ongoing pandemic has transformed the world and the job market. So it's really critical that we as leaders invest in trainings to make sure that employees can train new skills, making the market more competitive. Next slide, please.
Maxime?
Sorry, guys.
Okay.
I was on mute still. So to finish, I'd like to focus on the actions we've taken for our local staff in Nairobi. And from the start of the pandemic, we moved into what we called a global crisis mode, applying a centralized approach to all our offices. Our first priority was, and still is, obviously, guaranteeing the health and safety of our employees. Being a very important stakeholder as a health partner, it has also been critical to maintain business continuity, to be able to support our clients, members, and partners. We are now more than 1 year down the line, and I'm really happy to say that we've been very successful. All staff, except some critical roles, have been working from home in an efficient way throughout that entire period. We've been able to support our clients, members, and partners without disruption. Thirdly, despite the challenges, we've received a lot of appreciation from staff, and engagement levels really increased thanks to that intense, continuous, and transparent communication that we implemented. And last but not least, we took the opportunity to analyze our future way of working and are in the process of implementing some changes to that regard. That being said, and before handing over to Payal again, let me go through some of the actions we've taken, practical actions we've taken, which are visible on the slide and on the screen. So some examples. So first of all, we made sure that our employees, so we tried to break it down in 3 levels: working from home, making sure that the office was fully ready, and then thinking about how will the future look like, the new way of working, as we call it. First of all, the working from home aspect, we tried to make sure that people had the right ergonomics at home, the right materials to work, and to get connected, to keep connected with both internal as external stakeholders. We held a lot of well-being and mental health initiatives, also physical initiatives that we planned for, like for example live yoga or live fitness exercises, which we organized. We also brought in some experts to talk about the pandemic on a global level, but also on a local level, to make sure people remained really informed. We focused a lot on training and coaching. And we also provided some nice gifts to celebrate successes, which were delivered at home. Very well appreciated amongst staff, obviously. Secondly, the office readiness. So we changed a couple of things in our office to make sure that whenever critical roles had to come in, they could do that in a safe way. We also installed some flex desks and some booking tools to make, again, sure we could really control and do a proper contact tracing when staff would come in. Last but not least, and I think a very exciting and important one, is the fact that we also designed a plan, and we're still designing it and fine-tuning it for the long-term return to office, where the idea would really be to implement that new way of working, which means we will continue to have that hybrid model. People working from home can really use that time to focus on specific tasks, on individual tasks, on recurring project meetings, for example, calls, emails, while the office would really become a place for collaboration, for meetings, for interaction, and to share knowledge. So really exciting times. I think we took the opportunity to learn from the feedback that staff gave us about what happened here. It has definitely been challenging, but again, I think we can say we were successful, not only on the globe, or on let's say in our global offices, but also here locally in Nairobi, where we saw the engagement of staff also going through the roof recently. So a lot of exciting stuff. And we, of course, hope to go back to the office very soon. The fourth wave has been confirmed in Kenya, so it's difficult now. But by the end of the year, we really hope to start our phase 1, as we call it. So thanks a lot for the attention. Hope this was useful. And I'm passing back the floor to Payal. Payal, over to you.
Thank you, Maxime. That was indeed very interesting and insightful from the COVID-19 study carried out by Cigna. And just to add on, changes from the pandemic, as we know, are undoubtedly overwhelming for both employers and employees, but the actions that we take now will leave a lasting impact on organizations in the post-COVID world. As we know, the pandemic has paved the way for a new workforce and a lot of different wellness strategies. We should see this as an opportunity to readjust our focus towards well-being and mental health. Those are some of the closing lines that I'll leave you with. What I can do now is, because we've come to the end of the presentation from our end, I would like to open the floor for any questions that you may have.
Thank you so much, Payal, Maxime, and Helen. That was excellent. Quite some learnings from your study there. I think I'm just going to be looking on the screens to see if you have any questions. If you would like to raise your hand using the icon, you can go ahead. You could also type on the chat, or you could simply unmute yourself and speak. Yeah, let's do that. So maybe first we can get some insights from the people in the team. I can see some familiar names here. What are some of you doing for your employees during this time? Anything you would like to share in terms of your practices at your workplace? Okay. Alan? Maybe if we can stop sharing the screen so that we can see clearly. Thank you.
This is Alan.
Hi, Alan.
Yeah, very interesting stuff, and I like the model that Cigna has come up with, the emotional support model. I was just wondering, in terms of return to work, is it something that you've already worked on, or are you doing it in phases? Because most of us actually have a hybrid system where some of us are working from home and others are working we're working at the office. Or is it something that you're working towards, or is it's something that's already in place?
Yeah, thanks, Alan. This is Maxim. Happy to take that question. Really good question. Thanks for that. So what we have been doing, we have been quite drastic, let's say, from the start. As mentioned before, we have around 150 employees on the ground, and we really pushed everybody home. So we made sure that we provided all the materials for them to be able to work from home, which we have also been enhancing throughout. So so we added extra materials, we added to that connectivity. Sorry. And so that's one important thing. Secondly, what I also want to say is that we try to really have a global approach. So as you might know, we have offices a bit across the world, and we really try to centralize that, to have one voice, treat it the same way. What we see now is that, of course, with the different vaccination levels, that in the different countries, that some of these offices are moving quicker than others. What we have been doing specifically for Kenya, because I think that's where your question is coming from, is that today we only have critical roles in the office, so really roles that have to be done there. I'm thinking of claims intake, where things need to be scanned, etc. That's really what those are really the staff that are in the office today. Again, sorry. We only have around 5 staff going in on a daily basis. So we have been, again, very, very strict on that, keeping people at home. There's pros and cons to it, but when you look at the 4 waves that have been here in Kenya coming up, it has been highs and lows, and we really decided to bring consistency. Of course, what we now are going to try to do is to slowly open for new staff, new joiners, because we have quite some recruitments coming up, and we felt in the past years that, of course, new staff joining, not being able to see people, not being able to train properly, might impact just the way they onboard. So that's something we're going to do in a phase 1, and we were supposed to go back in allowing people. We have a very specific model where we would allow people to come back in September. We're going to push that a bit now because of that 4th wave going on. But we really have that plan to do indeed in different phases, based on, let's say, a number of desks that we can use in a safe way. And then if that goes well, we go to the next level. And that's really it. Of course, vaccination is key. I think that's something we really hope for, that in the 4th quarter we can kind of, Kenya will have access to more vaccinations, which will again allow us to do that a bit more in a safe way. Because what we really want to try to avoid is that we allow for people to go in and then having to close again and have not bringing that consistency, because that's exactly what we feel, at least, is coming over as the fact that leaders don't have the control over the situation. And we feel that's really, really important, to keep that control, to make sure that staff feel at ease and comfortable without we pushing them in a certain direction. So yeah, that would be my answer. Of course, we're also working, as mentioned, on the long term, which is a question mark when that's going to be, of course. But we're going to fully go for that hybrid model. So again, for example, we have an office of around a capacity of around 90 people, 90 desks. while we are 150. So we have designed a model already where there's going to be that hybrid model, people coming in, people like sales, client management, etc., will not come to the office, but only for collaboration, using meeting rooms, etc. So really have some kind of model that we're going to implement for the future, which also comes with a culture change, right? So we'll do a lot of that, supported by HR and of course marketing, communication to really make people feel part of that motion and change. Hope that answers your question.
Thanks.
Yes, it does.
Yeah, thank you. Do we have any other questions? We do have a comment on the chat. Someone is asking if the presentation will be shared. Maxime or Payal?
Yeah. We
Yes,
can definitely
yes.
share the presentation. Yes, I think it's important because there were a lot of numbers and percentages, so it's good to just slowly review it when you have some time. Yeah.
And thank you, More, for your comment. Thank you. This presentation has really been an eye-opener on mental health in the workplace and how to juggle work-life balance. All right. Do we have any more questions or comments? Feel free to also share what you're doing in your own place of work and how the whole pandemic has shifted and how you're handling wellness. Someone has unmuted. I don't know who that is. Patrick, is that you? No. Kindly go ahead and speak if you have unmuted yourself. All right. I don't think I see any more questions. So maybe we can just wrap up the session and I'll allow Cigna team to have their final remarks and then we can close.
Yeah, I'm happy to take that. Can you hear me well still?
Yes.
Yeah. So yeah, again, I want to reiterate your point of asking for feedback and asking for input, because I think it's critical. We are doing something where we feel it's the right thing. We, of course, might have the advantage that it's our core business, so we are offering it to other companies too. But still, I think it's really sharing ideas, having those discussions that is really going to bring everybody to the next level. Probably a second thing, and we talked a lot about it, is especially that emotional well-being, mental health. The key thing is communicating about it and opening the doors for employees to come and talk about it. And we really saw an impressive movement within our own staff, people really opening up about that topic. And it's very cultural, right? Because in other parts of the world, people might be, I would say, maybe too open, and others might be more closed, but still, that's why I think it's really impressive that even in Kenya also, where the topic was not super open or well discussed, I think this really allowed us to push people, communicate about it, and we really saw a very nice movement there. So again, I would motivate everyone to open that door and bring own stories, also be open yourself, so you will also get that feedback. So yeah, and last but not least, thanks a lot for the attention. I think thanks also for the good feedback, but let's say this is not an end state. I think let's continue that discussion, because yeah, we have an important role to play in these difficult times. So thanks a lot.
Thanks, Maxime. Payal and Helen, would you like to speak?
Thank you, Emily. From my end, it would just be to say, if you have any other questions, if you need any other support in terms of supporting the whole health of your employees, if you need to reach out to us, then I have posted in the chat box our details. You can reach out to us on email, by phone. And our office is at One Africa Place, 12th floor. Although we don't take any sort of physical visits at the moment, I think the best way for you to reach out to us would be by phone or email. So I'll be looking forward to hear from you. And thank you very much for your time on today's call here. with Emily and Rise and Learn. And Emily, thanks for giving us the opportunity to reach out to your community of HR practitioners.
Thanks, Payal. Helen.
Yeah, yes, Emily. So just to echo Payal's sentiments, to say that at Cigna, we have a large clinical unit of nurses and doctors. So again, if you want to reach out for some insights or, to give you some knowledge on what we have on the ground, please feel free to reach out to us. Thank you for your time, and thanks for engaging us. Have a good day, everyone.
Right. Thank you so much for making our community of practice so vibrant, engaging, and there's always something to learn. Thank you for the HR practitioners and the guests that we've had today for joining us, and those of you who've joined from the business functions. This recording will be shared, and we will also share the presentation as Cigna has confirmed. And should you have any questions, the contact details will be provided. We'll also share the material on our Rise and Learn community of practice. If you're not a member, we will share the link so that you can join and find all the recordings on that particular site. Thank you so much for your engagement and for your time. Have a lovely weekend, everyone. Bye.
Thank you. Bye-bye, guys.
Bye. Thank you so much.
Thanks a lot.
Bye.
Bye.